The DigitalHealth.London Pioneer Fellowship. It supports around 30 NHS staff to design and lead transformation projects that are underpinned by digital innovation. Now we're in our third year and the fellowship is now open for applications to the next cohort. Today, we're going to discuss the fellowship with people who've been through it and share some of their stories and advice for you. We hope this helps you to decide whether to apply for this fellowship and whether it's right for you, and if you're successful in getting a place on it, what you can expect. I'm Sarah Nelson and I'm leading the Digital Pioneer Fellowship, and as a nurse with over 25 years of experience and as Programme Director for the DigitalHealth.London Accelerator Programme, that supports the uptake of innovation. I appreciate that both challenges and opportunities are with this digital revolution bringing into the NHS. I remember when technology first came into my life as a nurse. I was sitting in a coronary care unit, an experienced and confident nurse clinically, and all of a sudden this big black box came into the corner. It sat there and we were told to input data related to our patient in a drug trial. The fear of putting in the wrong information, pressing the wrong button and affecting a patient by doing that was real and was strong. It felt much more scary than using paper. And I often think back to that moment. Digital innovation in healthcare is not just about technology. It's about communication and transformation of the staff and processes. Working together in collaboration, understanding the benefits and challenges of everyone involved is how you really make a difference and are successful in digital innovation. As someone who's also been on a digital leadership programme, I know that by taking the time to understand about your role in leading this change, undertaking formal learning, gaining hints and tips and support from your peers can really improve your knowledge and confidence and the chances of a successful implementation. The Digital Pioneer Fellowship is a 12-month programme. It provides fellows with the opportunity to be part of an action-focused learning community, focusing on accelerating the pace of digital transformation within their respective NHS organisations. The programme involves a number of workshops and events throughout the year, and we encourage fellows to share their real-life challenges and experiences from the digital projects they are leading. Fellows will be able to work with a mentor and be grouped into actual learning sets with other fellows who are working in similar environments on digital transformation projects. I'd now like to introduce Debs Das and Nicola Reynolds, two former digital health pioneers, to find out a little bit about their experience on the fellowship. So Debs, good morning. Please tell us about yourself and why you applied to be in the Digital Pioneer Fellowship.
Hi guys, thanks for having me. So I'm Debs, I'm a consultant cardiologist at the Barts Hospital in central London. I applied for the Digital Pioneer Fellowship because I really wanted to get a grounding in all things essentially digital. I'm a founder of an SME called Altus Eye Health, which is a remote monitoring platform. And I've been working with DigitalHealth.London for some years now from this. The company is also part of the accelerator. And I wanted to really get a true understanding of the digital space. And what I realized, one of the most important things about digital health, as Sarah mentioned, is actually not the technology, it's the people. It's the people on the front line who are trying to deliver this. And it's the change management that is the most important thing. And we've had the biggest change that we've all seen in this pandemic that has transformed what we're doing in the front line. But this is only the start of the journey. And the Pioneer Fellowship for me was the most important thing, was meeting the people in the same space, networking with other colleagues who have the same mindset, drawing on their experiences, their strength. And lastly was, I had quite a large project that I was there to try and deliver on. And I've never had really grounding on change management, how to go out and do this. That's the one thing that the Pioneer Fellowship really gave me a grasp on. The different techniques, the action learning sets was something that I've never experienced before, but I found them to be actually the most important thing. Even when there's something clinical that I couldn't make the whole day, I'll try and make my time for the action learning sets just through learning of other people's experience. So for me, if you want to get into the digital health space, and more we're now seeing this as a career, and I think that's a really important thing. Previously it was academia, going into management, more and more now, an understanding of all things digital health is going to be more pronounced. So this is a perfect way to start that journey and meet like-minded people. And then it will also give you opportunities elsewhere. I can see from participants here, my fellow pioneers, Syra and Yinka, two people have continued to talk with and do other ventures since the Pioneer Fellowship. So I can't recommend it highly enough.
Thank you, Deb. And Nicola, tell us about yourself and why you applied for the Pioneer Fellowship.
Hello, everybody. So my name is Dr. Nicola Reynolds. I'm a principal clinical psychologist in Oxley's NHS Trust, but more recently have been appointed as Deputy Clinical Director for Mental Health at the Health Innovation Network. So when I applied for the fellowship, I was really just beginning to become aware of the whole sort of digital transformation agenda within the NHS. I was leading on a digital project in a very small team. So my knowledge was still at a very, very sort of basic level. I was really just sort of starting out, but really starting to see that there were some real opportunities with working in sort of digital ways. And it was actually my manager that made me aware of the fellowship and encouraged me to apply. And when I read about it, it just sounded like a really good opportunity to develop my knowledge and understanding of digital transformation and to connect with the network around. So for me, the fellowship it exceeded all of my expectations. It was something that I learned so much from. The action learning sets were really, really helpful. Speaking with colleagues that were working in different areas and different teams really helped to sort of open my mind and to sort of think creatively and think differently about problems and solutions. The formal teaching was really, really helpful. And I think, as Deb said, sort of realising that there's a sort of science around this and sort of learning about change management and business cases, and that was all just really, really helpful. So for me, when I applied, I don't think I really quite fully understood what I was applying for, but I'm so glad that I did and would really highly recommend the fellowship to anyone who's got an interest in sort of digital transformation and ways of working.
Thank you, Nicola. Appreciate that. You mentioned about expectations, both Nicola and Debs. What were your expectations going into the programme, and what was the reality?
So, as I say, I think when I applied, I didn't fully know what I was applying for, but I remember going along to the sort of introductory day and feeling incredibly intimidated, listening to the cohort that had graduated previously and wondering if, I was going to be, sort of good enough. And my expectation was that we would sort of be delivering on a particular project that we had, were either in the process of delivering on or were thinking about delivering on, and just wondering whether I would, be able to do it and whether I'd be able to deliver on that. And in reality, the support that you get and the encouragement, not just from the sort of tutors and your mentors, but even the people on your cohort, it was such a supportive group. And I always felt able to sort of talk about challenges that I was having. I always really enjoyed the teaching days. I always came away feeling really energised, went back to my day job feeling, I had new ideas. And although my project, I had lots of challenges with my project, I came to realise that really the project was just a sort of vehicle through which to sort of practice and implement some of the things that I'd been learning about, and that actually, digital is about culture and it is about people, as Sarah already said.
Yes. Tell me about your expectations and your reality that you found with the programme.
Yeah, I mean, so I, for some time, wanted a career in the digital health space. And as a clinician, we often look for validation of why we should go into it by getting a certificate of something, doing a course in something. And I saw this as the exact same thing. I said, look, if people are going to take me seriously, there is a process involved here now. You're now getting an established framework of how things you do. You can't just call yourself someone who's interested in digital health without any grounding in it. And that's my first intention of why I came through this, to try and put to my CV that I'm a Digital Pioneer Fellow. I have undergone a course, accreditation. What I left with was something different. I left with a network of people, a network of contacts, an understanding of how to deliver even more so on the front line. And I think that's even more, I got the accreditation. I still, on my CV, I have a line, a Digital Pioneer Fellow. And I think that's equally as important. But what I left was even more surprising, was actually a network of people that I can maintain and progress that further, have phone numbers or emails that we can contact, say, oh, I've got an idea, and continue that digital health journey. So that's what I kind of expected, but what I got out was something completely different.
We were just talking about action learning sets and how they had been useful. Could you describe a little bit about what happened to you within an action learning set? Or
yeah, so our action learning set was a small group of us, and they're sort of a reflective group, I guess, and the idea is to sort of help each other to think and come to solutions about things. So it's not giving advice or telling people what you think they should do, but you can ask sort of supportive or maybe slightly challenging questions to try and help somebody think about a difficulty that they might be having. So we would all sort of take turns sort of facilitating the group, and each member would sort of highlight a particular thing that they wanted to talk about in that particular action learning set. And then we would just help them work their way through that challenge without actually sort of telling them what to do or giving them advice. So they were just they were very helpful, very supportive. I always felt able to be quite vulnerable and be quite open if I was struggling, but also felt that I could challenge people, and that felt safe, and people felt safe to be challenged as well. And they became such a kind of important feature of the fellowship that we all kept in touch with each other outside of the formal teaching days, and we still do. And even the whole, like the broader fellowship, we all still sort of keep in touch with each other via WhatsApp and things. So that network that Debs was referring to was such a valuable part of the fellowship, as well as the actual formal teaching.
Thank you. We've spoken quite a bit about how it made you feel and how it supported you, the programme going through. What about the impact that it had on your work or your career? Nicola, do you want to speak first?
Yeah, so for me, it's had such a significant impact. And again, that wasn't something that I would have predicted or expected going into the fellowship. I mean, the most significant impact it's had is that it led to me being appointed as the Deputy Clinical Director for Children and Young People's Mental Health at the Health Innovation Network, which is one of the sort of partners of Digital Health. So for those that don't know, the Health Innovation Network is part of the Academic Health and Science Network, and their role is to promote the adoption and spread of innovation in NHS. So it involves working with NHS providers, commissioners, industry to try and accelerate the adoption of innovative solutions. And I simply would not have been able to get that role had I not been through the fellowship, because I just wouldn't have had the knowledge and the skills or the confidence that I have now. And even in my NHS role, where I'm working sort of on the front line, the fellowship has enabled me to have conversations with staff about digital transformation in a way that I wouldn't have been able to before. And as a result of that, I've become increasingly involved in leading on sort of digital transformation projects and working at a much more senior level. And I guess my sort of reputation and profile within the trust now, I'm sort of increasingly recognised as being sort of digital leader and the person that people generally come to if projects or things around digital that people want to find out more about. So for me, in terms of my career, it's had a significant positive impact.
Thank you. Debs?
So I went into the fellowship as a final year registrar. in cardiology. And then I came out of it as a consultant, well, the first consultant of Barts Heart Centre, actually being allowed to be given 20% of their time dedicated to digital transformation. So that's now embedded into my clinical role, which wouldn't have happened without the Pioneer Fellowship, without the project that I was doing that the Pioneer Fellowship enabled. It's continued to allow me to develop the SME through the accelerator that I'm working with yourself as well, Sarah. And even in work outside that, I'm now a clinical lead working with Orca as well. So it's given a lot of opportunities to develop my career in the digital health space.
Fantastic. I think it's probably time for us to go to question and answer. I'm going to bring in Claire Francis from our team, who has been monitoring any of the questions that have come through the website or also through this particular session through the chat. So again, if you have any questions you'd like to put on the chat, please do so. And Claire Francis, can I invite you to come with any questions that we can ask the speakers?
Sure. So one of the first questions that we've received is, do you have to have a particular clinical role or a particular grade to apply to be on the fellowship?
Shall I answer that? No, I mean, it's in our cohort, there was such a variety of disciplines, which again was one of the strengths of the fellowship, because we could all learn from each other. So people from adult, people from child, people from the acute, people from community services. And again, people at all different levels. So some people were at a slightly more senior management level, but a great deal of people were the real sort of frontline staff as well. So I think so it's open to everybody. And I think, again, that was one of the strengths of the course.
Related to that, we've had another question where someone's asked, would it be suitable for a non-clinical person, you know, if you were responsible for social media and websites, for example, of an NHS trust?
Absolutely. I mean, this digital health now expands all facets of the hospital working life, clinical, non-clinical, administrative. I would recommend it for anyone that's working within the NHS, be it from a porter all the way to a senior exec.
Super, thank you. I've got a question which is around the action learning sets that you all spoke about. And it is, do you find yourself actively using that format and that structure in the roles that you're currently doing?
Yes, I mean, I certainly took that into my team meetings. So as a team manager, I've tried to sort of adopt that.
Honest answer, no. The right answer, probably I should do. Now, sometimes we all get carried away with the day-to-day kind of side of things, but yeah, on reflection, yeah, probably in the future, I will do, yeah.
I think one of the things with action learning sets, I think when people aren't familiar with them, it takes a little bit of getting used to the sort of style, because we're quite used to in team meetings. It's sort of, here's a problem and we've got to come up with a solution and we've just got to get through this agenda. It's a slightly different way of working and thinking about a problem. So I think it did take us all a little bit of time to get used to it, and we would often catch ourselves just giving someone advice and we'd have to quickly stop ourselves. So sorry, you know, we're not going to give you advice. But it was once you got used to it, got familiar with it, it was a really useful learning tool.
But I think one of the most important parts of the action learning set was everyone there had no vested interest at all, which is unique in a hospital setting. When you're trying to do something, often, you know, advice comes with other agendas. And so here you had a group of 5 to 6 people that really all they were there for was to try and benefit each other and yourself. No vested interest at all. So that, I think that's what one of the beauties of it, translating that into real life. I can see some benefits as well, but the beauty of the Pioneer Fellowship one was really you had like a sounding board of a group of people.
Okay, thank you very much. I've got a question here, which is around, is the fellowship mainly practical applications of existing projects of the delegates? This question comes from a GP with a number of digital change management projects that they're looking to scale up. So do you think it would be appropriate for them?
Certainly. I mean, there were lots of projects, large scale, small scale, some in even inception, that were there that started from an idea, and by the end of the fellowship had started. So I think even coming in with not an idea that you don't like, doesn't bear to fruition. This is all about learning through that journey itself, and even if the project that you come into is not successful, the journey should help you make your next project more likely be successful.
Yeah, I would agree with that. And I think, you know, I came into the fellowship with a fairly well worked up project, but then during the course of the fellowship, you know, there were some real challenges and the project sort of stalled. But I was still able to take away so much learning from the fellowship that I was then able to apply in other digital projects that I've gone to lead on. So I think don't be put off if you feel that you haven't got a very well worked up project at this point in time, because the fellowship is partly there to guide you through that process to help, you know, get you to something that is more worked up, or as Deb said, even if you end up not going on to do that project, the learning will help you with future projects.
Thanks. I've got a question which may be best for Sarah. Is the fellowship open to applications outside of London, and if not, is there an ambition to do that in the future?
So at the moment it is London and the South East that applications are open for. Obviously the success of the programme has been shown to be quite important for staff in the area, and so we will look at how we can develop it further over the next year. However, currently we are London and the South East.
Thanks. And then for Nicola and Debs again then, did you find that learning about Agile working changed the way that you ran your projects?
So I already knew a little bit about Agile working from somebody that was in our teams. We'd already been trying to sort of run our project in that kind of way. But it is a really useful you know, methodology, and it was really helpful to sort of hear about that in more detail. And a lot of the teaching was very interactive as well. So you actually got to do some quite fun exercises, and that was always really helpful to then take that back into your projects. And again, it's quite a culture shift, Agile ways of working, from the more traditional approach in the NHS, which is sort of quite waterfall approach. So in terms of my future projects, sometimes that's been the challenge in terms of trying to change that culture and helping managers to understand that it's okay to test something on a small scale, you know, rather than waiting until you've got something really, really polished. But I think the sort of quality improvement agenda within the NHS, it's helped with that, because there's a great deal of overlap between Agile ways of working and the sort of PDSA type of model within the quality improvement methodology.
Yeah, I mean, I came into the fellowship having no idea what the hell Agile working was, or any kind of what's a PDSA cycle. I was doing half these things just by doing them. What it helped me was to get the right terminology to then explain to who I'm trying to get people to do stuff for me, and convey my idea of the project, idea of rapidly testing. Certainly from a clinical background, we have something called Get It Right First Time, which is the complete opposite of Agile working. And so it's that clash, it's the ability to understand, you know, the benefits of it and then can convey it to others, because that's the most important part, is that this change management piece is conveying your idea, your enthusiasm, and getting other people to ride that journey with you. And this, a grounding in the science of it does help.
Has anyone got any practical advice or advice for the actual application? So it's an application process which is available online, and then from that there's shortlisting and then interviews. If you can remember back to when you applied, is there any advice that you would give?
I think for me, I mean, obviously having the support of a manager is important, and I certainly had that. I I think in terms of the actual application form, as I said earlier, I wouldn't be put off if you haven't got a really clearly worked up project yet. But as long as you can demonstrate that you have some sort of a understanding of what the problem is that you're sort of hoping to set out and solve through a sort of digital solution. But I think just get across your sort of passion and your interest. If you've got any interest in sort of digital ways of working and developing your knowledge of doing that and developing your network, this fellowship, would be really, really valuable, and I would really encourage you to apply for it. And if that sort of passion and interest comes across in your application, then I think that would be really helpful.
Yeah, I would agree. I don't really have much to add. Just as long as you set aside a vision for either yourself or your project and you're honest to that.
Great, and then I think this might be the last question we've got. How will the fellowship be delivered given the current global pandemic? Are you going to look at incorporating more virtual learning and that sort of thing?
Probably comes to me then, doesn't it, Claire Francis? Yes, we are looking at, unfortunately, it will be starting with virtual learning. Everybody within the programme found the benefit of actually meeting and being with people really important. So we have to look at how we can produce that during virtual learning. There will be a lot of individual group work that allows you all to take part, but we're looking at developing this, and obviously the intention at the start will be to be virtual learning. Towards the end, we are hoping that we will be able to do some face-to-face sessions, but we will have to grow as the changes happen. Thank you. If that's the last question then, Claire Francis, I've got one more thing I just want to ask for both of our speakers today. If you could sum up your experience in just one word, what would it be? Deb?
People.
People. Nicola? Inspiration. Fantastic. Well, I can honestly say that you this is really corny then to finish, but thank you, because you are people who are inspiring to the rest of us. So thank you for being our speakers today, for giving us your thoughts and for sharing your experiences with us.
Thank you.
I want to ask everybody else, please don't forget to visit the DigitalHealth.London website, digitalhealth.london/our-work/Digital Pioneer Fellowship for more information and details of how to apply for the programme. We look forward very much to seeing your applications and meeting you in person, and good luck for the future. Thank you.
Bye.
Thanks. Bye.